Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm just happy to be here.
Collectively, we're the hosts of PodcastDX. On today's show, we're going to talk about COVID-19, the common cold, seasonal flu, seasonal allergies, and smog.
Let me start by saying that every individual is different, and your body may respond to bacteria or viruses or allergens and other factors differently. We're going to be talking about things affecting the upper respiratory tract in broad strokes today. If you have a specific concern regarding COVID or any other health conditions, please contact your healthcare provider.
When in doubt, reach out. Okay, so the common cold, seasonal allergies, COVID, some bacterial infections, smog, or, pollution, or other environmental factors, and the flu virus can all cause upper respiratory symptoms. They affect your nose, like a runny, itchy, or stuffy nose, which, by the way, in case I happen to sniff during
She has
this,
all three.
I have it because I've got allergies, right? It is allergy season here in the Chicago area. They can affect your throat. You could have an itchy, scratchy, swollen, or sore throat.
Lita also has all of those.
No, I don't. I don't have a swollen throat.
Oh, okay.
But I do have a little postnasal drip from the allergies.
Mm-hmm.
They may make you cough. I don't cough.
I was going to say, did we need a demonstration of what a cough was? Okay.
Just in case.
Okay.
They may make it...
We're trying to short stuff on our sound department effect now.
Yeah.
Right. We're now doing sound effects.
Oh, boy.
They may make it difficult to breathe. I'm not going to demonstrate that.
No, thank you.
And you may have elevated temperature as your body responds to these invaders.
I will now want to talk about common viral infections, not the bacterial, but the viral type. Those include the common cold, the seasonal flu, SARS, which I think we've all heard about in the past, severe acute respiratory syndrome, and what we are dealing with now in this pandemic, the COVID-19.
Right, and they all kind of look differently. Like COVID kind of looks like a ball with a bunch of golf tees stuck on it. But so a virus is...
Wait. You're not going to go into your mutant peanut butter and jelly analogy again, are you?
Well...
No. What is the mutant peanut butter and jelly analogy? I'm curious.
Trust me, you don't want to know.
Viruses are microscopic...
Go ahead and tell them about the peanut butter and jelly.
No, it's okay. It's okay. I'll tell them later.
She wants to say that if you have a peanut butter and jelly
I was trying to make it an analogy so you could kind of understand viruses.
So if you have a peanut butter and jelly sandwich, you have to have the peanut butter and the jelly.
And the bread.
Otherwise,
it's not a peanut butter and jelly sandwich. That's how viruses are. So if you get a vaccine, you're not getting a peanut butter and jelly sandwich. You might be just getting the bread or just the peanut butter or just the jelly. So
you're not going to get sick from the vaccine.
Right.
For people that are kind of, worried about vaccines.
Right.
But anyway, go ahead, Jean.
Okay. So
I'm hungry now.
Oh, good.
Wait a minute. You're low carbing.
Yeah. You could just do peanut butter and jelly.
But then it's not a sandwich. So,
no.
So then it could be a vaccine.
It could be a vaccine. All right. So, okay. Oh, boy. Viruses are microscopic or very, very tiny infectious agents.
But they're not?
Peanut butter and jelly sandwiches.
Right.
Or bacteria, which are a living thing that can replicate itself.
Right.
So in very basic terms, a virus actually takes over your cells in your body and puts them to work and forces them to make more viruses.
Because they don't have the peanut butter and the jelly.
Right.
They need you to make the rest.
Right. But they come with all the instructions to make the peanut butter and jelly sandwich. Mutant peanut butter and jelly sandwiches.
Yes.
And then as a result, they often destroy or damage your hijacked cells.
And when you have a virus or a bacterial respiratory infection and you talk, cough, or sneeze, the tiny droplets containing the virus can spray out into someone's eyes, nose, or mouth, or land on a hard surface.
And there's great videos of this online. You can actually see someone cough and how far it spreads.
It's like 9 feet, right?
Yeah, and then if you cover your mouth, it just spreads above and below your hand. And if you put your face and your elbow and cough, it goes above and below again. So that's why it's so important to wear a face mask.
Or completely cover your
Well, I think wearing a face mask when you cough
Is best.
is best. And you also want to wear a face mask so that someone coughs or is talking even to you, that those little droplets don't go in your mouth. But you also, you have to be worried or cognizant of the fact they could go in your eyes or your nose.
And then I've seen a graphic online where it has a person that's coughing that is wearing a mask and somebody that's near them. So that person that's near them is somewhat protected. But if you both have the mask, then it is the
optimal.
Best protection. Yeah. So even if you're not coughing, wear a mask.
Yeah.
Okay.
One thing, just because I've seen a lot of it in the news, I've seen pictures. People are wearing the mask, but a lot of times they're not covering their nose.
I know.
Yeah.
They think that it's
mouth.
Right.
Yeah, you have to have it over your nose and your mouth. And if you can, then a secondary protection over your eyes. In healthcare settings, people will wear like a splash guard.
Or those safety goggles?
Or safety goggles, because that's another level of protection.
Right.
Whereas our neighbors who keep throwing barbecue parties aren't wearing anything, and then they all have their kids in the neighborhood congregate, which is very scary. It's like, because let's say I have the flu, and I cough while I'm talking with you, okay? So millions and millions of flu virus particles fly out of my mouth with that one cough, or with every cough,
right,
and into your eyes, nose, or mouth.
Okay, can I stop you right there?
Sure.
I just read a news article last night that said the biggest thing that they've learned recently is the viral load of the person will determine how sick the person is going to be. So in other words, if Jean coughed and those millions of particles flew out of her mouth, and somebody was right next to them and inhaled all of those millions of particles, that would be a somewhat decent viral load. They might get really sick. However, if she was 6 feet away from the other person and one germ traveled and got into the other person, they would have a very small viral load. They might get sick, but it would be a lesser sickness.
Every little particle of virus that gets into your system is going to start replicating.
Right.
So the more you have, the more damage they're going to do. Right.
I just wanted to throw that in.
Oh, sure. And then you can also cough and then cough on a hard surface. And viruses, once again, they're not like bacteria, which are living.
So they don't crawl around.
No, they don't crawl around, but they also can last a goodly amount of time.
Right. I think
a couple of days.
On cardboard, like 4 days or something.
Yeah. So that's why you need to be careful when you say you order food from a restaurant. If the people in the restaurant aren't wearing masks and someone coughs and they happen to be sick, and then you eat that food, you can get sick because those viruses are still able to replicate.
Right. And we just recently got a package delivered, and it was in a cardboard box, and Jean said, don't touch the box because you don't know if the delivery guy had
the delivery person, whoever packaged it.
Right.
It went through countless carriers. So I said, just leave it for a couple of days. We did have to open the box with all the trees because those had to be watered. But other things we're leaving for a few days.
And then if you do have to open the box, or if you do have to touch it, wash your hands. All right, go ahead.
Sorry, Ron.
Sorry. Go ahead, Ron. You were going to say something.
Well, what I was just going to say, the PSA for the day is, 1, be cautious, and 2, if you're going to be wearing the protective mask and so forth, make sure that you're wearing them properly, because you don't want to give yourself, a false sense of security.
Right.
Yeah, that's a great point.
Cover the mouth and the nose.
Yeah, good point.
Okay, back to the doorknobs.
Okay, so say I cough in my hand, and then I turn on a light switch, or I grab a doorknob, or I push a button in the elevator, I could be spreading the viruses to where that hard surface, and again, they can last there for several days. So you want to, if you are wearing a mask and you're coughing, then it's going to catch it. Most of it. And then now, depending whether or not you've had this specific virus before will make a difference, or if you've been vaccinated against it.
That's for the flu.
Well, there's vaccines for many viruses. There aren't, not for the common cold, but
not for COVID yet.
Not for COVID yet, but once there is a virus, then your body has learned what the peanut butter and the jelly and the bread look like, and can react quickly and efficiently to destroy those the particles of the virus that enter the body. And then there's a whole bunch of other factors. But the virus can start to take over your cells in your body and replicate, and that's how you get sick.
And it's not just the respiratory system. It can go elsewhere.
Right. With COVID, it could be a number of things.
Right.
It seems like they are seeing, like some of the initial symptoms would be
because
the
they inhaled it.
Right.
Well,
So,
I'm sick just thinking about that.
getting back to the respiratory system, one way to avoid respiratory viral disease is to practice what we were talking about, good personal hygiene. Jean talked about it a little earlier. Cover your mouth when you cough or sneeze. And we're finding out now it's better to actually cough into your shirt or what have you versus just into your hand because it can go all over. Also, after you're done coughing, doing whatever, wash your hands. As a matter of fact, wash them frequently. And when you do that, make sure you use soap and water and scrub them thoroughly just to make certain that you're not spreading any of the bacteria. And whenever possible, limit your interactions with people who are exhibiting signs or symptoms of a respiratory illness. That way, the more protection, the better. And also avoid touching your eyes, your nose, or your mouth. It is so easy to touch a surface and then inadvertently put your hands in your mouth or what have you. And it's very easy to get the virus that way.
Yep.
So careful.
Good point. Actually, I was I had someone when I had patients. I was an EMT and medic. One patient came in with pink eye at the beginning of a 2-week period, and I said, I think this individual should go home. They should not be here. And because we were out in the field and people didn't have easy access to soap and water, and that was my recommendation, that they go home. But because they were in a leadership position, they said that they were going to stay. And by the end of the 2-week period, we had 45 individuals with pink eye. Because, they would use pens and other things that would pass from person to person.
You're in a tight
quarters and also just didn't have access to soap and water. And, it was...
Now everybody knows that the military is not very hygienic.
No, but it's very, very important to wash your hands with soap and water. You can't just use the alcohol-based hand sanitizers. When in doubt, use soap and water.
Right,
and
you can't count on that.
No, yeah, that's the best thing you can do. All right, so let's talk about some of the common signs and symptoms you might see with COVID-19, the common cold, the seasonal flu, seasonal allergies, and other respiratory irritants.
All right, according to the World Health Organization, people with COVID-19 generally develop signs and symptoms, including mild respiratory symptoms and a fever, on an average of 5 to 6 days after infection.
And I wanted to add that a fever, cough, and difficulty breathing are common and potentially severe symptoms of COVID-19. Additionally, people with COVID-19 may vomit, they may have nausea and or diarrhea. Remember, everybody is different. Some people may have no symptoms at all or a very mild illness, whereas others may get it pretty severe. And unfortunately, hundreds of thousands of people have died.
Right.
Yeah, that's
the bad. Yeah, that's the bad news.
For those living with other medical conditions, for example, a compromised immune system, say you've had an organ transplant or something, and you're taking immunosuppressant drugs, or other high-risk groups, COVID-19 can be particularly dangerous and life-threatening.
However, symptoms for the common cold typically include a headache, a stuffy or runny nose, postnasal drip, a sore throat, and general malaise, which is like, I just don't feel like doing it today. With the common cold, you may cough and or sneeze.
And then when it comes to seasonal allergies, which you probably already know that you have because it happens the same time every year, there's often an itchy component. So like an itchy nose, an itchy throat, or itchy eyes. And allergies may result in postnasal drip, Lita.
Oh, yes.
And which can then in turn result in coughing and or sore throat. And you may notice that your allergy symptoms are worse at specific times of the year.
Similarly, you may find that it's more difficult to breathe when there is a higher level of ozone or smog in your area.
Yeah, I can tell you when the air is not quite right because I can't breathe.
Then we also have the seasonal flu.
Mm-hmm.
And I think Lita is going to tell us some stuff about the seasonal flu. What are some of the symptoms, Lita?
Well, have you ever felt like you've been hit by a truck?
No, I've never been hit by a truck.
Oh, okay. I had the flu. Actually, Jean and I both had the flu in the beginning of 2020. And I spent 2 weeks in bed, utterly exhausted. 1 minute I was fine. And the next minute I had fever, chills, and I was sore all over. Everything that I broke a toe once. That toe was killing me. I broke my thumb once. That thumb was killing me. So anything that you've ever injured was absolutely on fire. Terrible pain. I felt like I had run a marathon in stilettos. What's a stiletto?
Oh, really high heel?
Oh, yeah, like me. With a rucksack filled with sand. Jean wrote that for me. You cannot picture me in stilettos ever, people. But anyway, I felt terrible. I had a headache, a sore throat, a runny nose, and no appetite. As a matter of fact, I lost, I think, 14 pounds in the 2 weeks.
Well, I'm guessing then that you had all the symptoms of the seasonal flu.
Yeah, I think I did.
And I think that if you're taking precautions and you haven't interacted with anyone who has who is sick or has recently had an upper respiratory infection, and you have no symptoms, then you should just stay the course at this point and keep your distance.
Correct. However, the difference between the seasonal flu and COVID-19 is that the seasonal flu, we do have a cure. We have Tamiflu.
Well, and we also have precautions. We have vaccines.
Vaccines to not get it. But
right.
If we got it, at least we have Tamiflu, where Tamiflu doesn't do anything with COVID-19. So that's why we're all staying away from each other.
Right.
Because we don't want to get it because there is no cure yet.
Right.
Okay,
and there's only so many respirators, and respiratory intervention at an early stage is ideal.
Right.
And so, like, the people that are saying, oh, well, I don't care if I get sick. Well, you might not care, but don't be selfish,
right,
because there's only so many respirators.
And the healthcare people certainly care because they're working overtime. They're working hard, folks.
So stay home for everyone else, if not for yourself.
Yeah, let me interject here because I have a personal story with this COVID-19.
Uh-huh.
You guys all know about the organization that I do the diving with.
Dive Hard.
And
yeah.
Good organization.
And one of my good friends, who's a dive instructor, actually contracted the coronavirus, the COVID-19. And ironically, I was talking with him a couple of weeks before all this happened, and he thought it was a hoax. He thought it was, just the flu on steroids and all this. And unfortunately, he contracted it to the most severe, he got the most severe symptoms. He was hospitalized 2 weeks. He actually just got moved to a rehab hospital now, but he was on a ventilator for 9 days and intensive care for 13. And I just recently spoke with him, and I asked him, I said, well, when we talked before, you seemed to think it was nothing too major. What do you think now?
Yeah.
He said, boy, was I wrong. He said, I would not wish this on my worst enemy. He goes, I thought I was going to die.
It sounded like he probably could have.
Yeah, he actually said that, his numbers would go down daily. They put him on dialysis. They had him on oxygen. He was on the vent. They were getting ready to pull the plug.
Oh, wow.
And his numbers started going in the other direction. But we had a big prayer chain for him and so on. And he's in recovery now, but he still has a long way to go. And he still is having difficulty with moving his arm because it was flaccid for so long.
Okay.
And just the whole thing with getting his body back to quote unquote normal, he still has a long road to recovery. And he said this thing, he had never felt anything as bad as this in his life. So, and the ironic part with the type of work he does besides the diving, his paid job he's an accountant, so he does not have a lot of contact with community or so on and so forth.
Mm-hmm.
He thinks he may have gotten it from having dinner with a friend, just by happenstance.
Wow.
So not really having that much of a lifestyle that would lend itself to this, but just being around people. And he did a complete 180 as far as his thoughts and beliefs about this disease.
Sure.
So,
Well, as of Friday afternoon, data compiled by Johns Hopkins University here in the United States.
And this is as of April 24th.
Okay, I'm sorry. Yes, Friday afternoon, April 24th. The total number of killed in the U.S. has reached 50,000 people. And we are far higher than any other country. Actually, we're 3 times higher. We have 3 times more than any other country. But as far as the worldwide, there's been 190,000 have died worldwide, and the United States have 50,000 of those. Globally, the total cases confirmed, and there's not a lot of testing.
Mm-hmm.
Confirmed testing has already reached 2.7 million.
Right, and most of those cases, there isn't a significant number of individuals fully recovered yet, so we won't actually know how severe this is until you have everyone has recovered, because as of right now, I mean, you could have additional deaths.
And they're saying that people that have died at home,
mm-hmm.
They don't know, they're not testing everybody just
Right.
because they died. They're only testing people that have died in hospital that have been tested in hospital.
And
there may be more.
As of the 24th, there are issues with the antibody test to see if you did have COVID. There was a study out of Stanford, and there are a number of issues with that particular study. So
they're still working on everything.
Yeah, they're still working on it.
So give these researchers time to work. Our suggestion to everyone, no matter where you're listening, no matter what country, give the researchers time to work and stay home.
Right. Ask yourself, would you go outside if you knew would you be running to this store for whatever it is if you knew you were going to die because you did that, or a friend or a family member would die?
Hang a sign on your back door or on your door before you leave. Hang a sign there and say, it's deadly out there. And it is right now, because we don't have a cure. We don't have ideas. We're working on it. It takes time to research this. It takes time. Give the researchers time and stay home. We're going to get through it. It's going to be a hard, whatever amount of time it is. It's going to be hard. It is hard for everybody. It's harder for some than others.
Right. But there are some things that are being done that I think are very intelligent. For example, where we go to the grocery store, they are cleaning every single cart with bleach in between uses. They only permit 50 people in the store at a time to limit store. Interaction. Although the bakery aisle had at least 12 of those people in it. They have one-way aisles so that you're not passing individuals, so that everybody's going in the same direction, which not everyone wanted to stick with that plan, but there's a reason for that. It's so that you're not coming face to face with anyone.
And you had to wear a mask.
And you had to wear a face mask covering your nose and your mouth. And they're limiting people, in general, so that, and then they're taking every considerate care with their employees as well. They have a shield between you and the cashier. So they're doing what they can. And I think we can all take steps. I know it's hard on young children. It's very, very difficult, but if you can limit their interactions with other children, this isn't like, there's families that have chickenpox parties, and that can be deadly as well. This isn't, would you risk your child's life so that they could play with other kids? It's that serious and unfortunate, but I think we all can do our part. And it's not easy to be told what to do and have to listen to rules and regulations. And it's not easy when everyone's struggling financially.
My heart goes out to the small business people.
Oh, yeah. But if you can, for example, a lot of the small businesses that we love small businesses, love to buy from small businesses. They're allowing you to make advanced purchases that will not be shipping for some time because they can't get into the office or wherever to make their product. But you can make purchases that will be shipped at a later date. Even Arbor Day. You can buy the potted plants, but you can't buy the bare root plants. But yeah, do what you can. Ron, what have you found to help you during this period?
Well, I have my kids staying with me, so I have a lot of interaction with them versus living here alone.
Mm-hmm.
So you're working from home?
I am working from home. Thank God for the internet. And we are using, you guys familiar with Zoom?
Yes.
Yeah. Mm-hmm.
The video conferencing.
Mm-hmm.
So we're having a lot of meetings through Zoom.
So
and
with your grandma and the kids and
work. And
yep.
How are you interacting with your students?
Through email and Zoom.
Okay.
In Class Dojo.
Okay.
So, I mean, it's obviously not the same as being in person, but, you know, you have to learn to adapt. And in these times, that's exactly what we're doing. We're trying to make the best out of a bad situation.
Mm-hmm.
So, you know, it's working. We're still being able to work with the students and be able to get our own work done.
Okay.
And like I say, you know, with my kids staying here too, it's healthy in the sense that we're able to do things together as well. So, you know, it's a struggle not going out or not being able to go out when you want to, but the bigger picture is we're all going to be healthy. So
right.
We do what we need to do now. And as you said, you know, things are going to get better. And we do our part now, and down the road, get back to quote unquote normal.
How is it going with homeschooling?
Well, my daughter's in college, and she's just about done. She's got about another week of classes.
So yeah, she's definitely homeschooling because she used to go to Washington.
Yeah.
Okay, yeah.
Yeah, that's a whole story in itself, and we don't have time for that.
Yeah.
But she's definitely a kid who needs to be in class.
Okay.
She likes the face-to-face, so
Mm-hmm.
this has been difficult. But again, it's just something she's got to do. And my son is doing the homeschooling too. And he misses being at school for as much as we hear kids complain about not liking school.
Mm-hmm.
He misses his friends. He misses the interaction with the teachers. And he misses baseball practice.
Mm-hmm.
Oh, yeah. Yeah, definitely.
Yeah. But again, we're all trying to do our part so that we can get on the other side of this disease and kind of move forward and hopefully soon come up with a vaccine. But again, the overall thing is we're trying to do our part so that we're not spreading it or catching it from someone who may have it, just so that, you know, we can get past this. And like you said, Lita, we will. It's just going to take a little bit of time.
Right. All right. Thank you.
So I think we're going to end with whatever your diagnosis is, whether it's allergies or the flu or what we were just talking about, this COVID-19. We wish all our listeners out there a very healthy and safe day.
Absolutely. And if our listeners have any questions or comments related to today's show, they can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a 5-star review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.